going to talk about common medications that we use for hypertension, in other words, high blood pressure in Nigeria. And to make things very easy today, we're going to talk about those medications based on their classes. The first class of medication we're going to talk about are the dihydropyrimidine calcium channel blockers. The two most common ones that we use in this class include amlodipine and nifedipine. How does this medication work in our body? So they block the L-type calcium channels in the vascular smooth muscle. So by blocking this channel, that allows the blood vessel to relax, and the blood vessel is what normally carries blood in our body. By causing them to relax, so that allow the resistance in those blood vessels to drop, and that allow them to bring our blood pressure down. Common side effects includes peripheral edema, which is swollen ankle. Sometimes patients will experience headache, flushing, dizziness, sometimes fatigue. So in terms of price, so for amlodipine, depending on which pharmacy you go to, you're looking around 700 to 1,500 for 28 tablets. For nifedipine, you're looking at 1,000 naira to 1,000 naira for 20 milligram slow release tablets, 30 tablets. But for the long acting, because the long acting, that one you have to take it maybe once a day, as opposed to the slow release, whereby you have to take maybe twice a day for that. But for the long acting, whereby you have to take one tablet, depending on which pharmacy or the strength you want to buy, you're looking around 11,000 to 30,000 for 30 tablets. Moving on to the next class, which is angiotensin converting enzyme inhibitors and angiotensin receptor blockers. So I decided to put these two classes of medication together because they kind of like work similarly. So under the angiotensin converting enzyme inhibitors, we have the lisinopril and enalapril. So those are the medications that end with pril. And under the angiotensin receptor blockers, we have the losartan, valsartan, and those are the ones that end in sartan. The valsartan is also called Dalvan, depending on what type of brand you buy. So let's start with the angiotensin converting enzymes inhibitors. So here we have the lisinopril, enalapril, captopril, and ramipril. So how do they work in our body? So they inhibit angiotensin converting enzyme, and this enzyme is normally responsible for the production of what we call the angiotensin 2. And this angiotensin 2 normally causes tensing of the blood vessel. So it can tense the blood vessel. So by blocking this enzyme, that allows the blood vessel to relax and thereby decreasing the blood pressure. Another thing that this enzyme also does, it decreases the production of the secretion of aldosterone. And aldosterone is one of those hormones in our body that causes retention of salts and water and helps to get rid of potassium from our body. So common side effects with this medication, dry cough is a big one. So if you're on this medication and you're experiencing dry cough, then you might need to talk to your doctor. They will probably change you to the angiotensin receptor blocker. It could cause dizziness, headache, and it could increase potassium, especially in people who have kidney problem, kidney disease. And then really, it could cause what we call angioedema, whereby the tongue, the lips are swollen, and the face. But if you're on this medication and your face is developing angioedema, you need immediate medical attention. You need to go to the hospital immediately. So in terms of price, so for lisinopril, depending on which pharmacy, you're looking between 1,200 naira to 2,000 naira for 28 tablets. For enalapril, between 1,500 to 2,500 naira for 30 tablets. For captopril, between 1,000 to 1,800 for 30 tablets, and ramipril between 2,000 to 3,000 naira for 30 tablets. Moving on to the next class, which is angiotensin receptor blockers. This includes losartan, valsartan. Mechanism of action, so they block angiotensin 2 receptor. So instead of blocking the enzyme, they're actually blocking the receptor that this angiotensin normally works on. So by doing that, that allows the blood vessel to relax. In other words, it causes vasodilation. Common side effects include dizziness, headache. It could also cause high potassium, especially in people who have kidney disease or people who are taking multiple medications that could cause increase in potassium. They could also cause fatigue. In terms of price, for losartan, depending on which pharmacy, you're looking at 2,500 to 4,000 naira for 30 tablets. For valsartan, you're looking at 3,000 to 5,000 naira for 30 tablets. And of course, we also have other classes of medication on this group. But the most common one that we see a lot, usually losartan and Vasatan and Temistatan. Moving on to the next class of medication, which are what we call the diuretics. So these are the medication that make you pee by getting rid of salts and water from the body. So under this group, we have the thiazide, we have the mineralocorticoid receptor antagonist, and we also have the loop diuretics. So we're going to start with the thiazide. So under the thiazide, here we have the hydrochlorothiazide. Although there are other medication under this class, like things like indapamide, metolazone also belong to this class of medication. So how does hydrochlorothiazide, how does it work in our body? So it inhibits the sodium chloride co-transport in the kidney, particularly in the distal convoluted tubule. And by doing that, that increases excretion of sodium and water. And by getting rid of those sodium and water, that helps to lower the blood pressure. So what are the common side effects as you're going to expect, right? So if you're getting rid of electrolytes, in other words, getting rid of those salts from the body, so it could cause low potassium, it could cause hyponatremia, which is low sodium. It could make the uric acid to go up. So this uric acid is one of the breakdown of the cells in our body, and that will increase the risk for gout. It could cause high blood sugar, it could cause high lipid, and it could cause photosensitivity. So in other words, because this hydrochlorothiazide, they contain sulfur, so if you go under a sunlight, that could cause changes in your skin because of the sulfur that's present in the hydrochlorothiazide, so it could cause photosensitivity. So in terms of price, so depending on which pharmacy you go to, you're looking between 700 to 3,500 for this for hydrochlorothiazide for 20 tablets. So depending on which pharmacy, 20 to 28 tablets, depending on which pharmacy, the prices varies. Moving on to the next class of medication, which is the loop diuretics. So under here we have the furosemide. Although there are also other class of medication under this, there are also other medication under this class, like things like Bumes, ethacrinic acid, they fall under this medication. But furosemide, which is also called Laces, is the most common one that we use under this class of medication. So in terms of mechanism of action, so they block sodium potassium chloride co-transport in the kidney, particularly in the thick ascending loop of Henle's, and they promote excretion of sodium, chloride, water, and potassium from the body. Common side effects from this medication, as you could expect, so it could cause dizziness, headache, electrolyte problems, so it could cause low potassium, low sodium, it could cause dehydration, low blood pressure. And then very rarely, especially if you're taking a lot of dose of this, if you're taking very high amount of this medication, it could affect hearing, so it could cause ototoxicity. In terms of price, so also depending on which pharmacy you go to, so 100 naira per tablet to 1,000 for 20 milligram strength of this medication. Moving on to the next one, which is spironolactone, which is also called adactone. So this fall under the class of aldosterone antagonists. So they are also referred to as potassium sparing diuretics. So in other words, they allow our body to retain potassium because the way the aldosterone normally causes retention of salts and water, sodium and water, and get rid of potassium. So if you are blocking the aldosterone, right, so reverse of that is going to happen. So you're going to be losing salt and water, but you're going to be retaining potassium. So that's why they call them potassium sparing diuretics. So they antagonize aldosterone receptor in the kidney and increases sodium and water excretion while retaining potassium. So common side effects, as you expect, so it can cause increase in potassium, so which is what we call hyperkalemia. It could cause gynecomastia. So because the spironolactone contain androgen, which is a form of hormone in our body. So as a result of that, that could cause gynecomastia, which is enlargement of breast in a male. And in female, it could cause menstrual irregularity and a sexual dysfunction, which are kind of like very less common side effects. The sexual dysfunction and the hyperkalemia are usually less common side effects. Also, they could have dizziness and dehydration and headache. In terms of price, depending on which pharmacy, so for adactone, so you're looking at about 3,000 to 11,000, depending on which pharmacy you go to. So moving on to the beta blockers. So here we have the atenolol, metoprolol, we also have bisoprolol, we have carvedilol, we have labetalol. So there are a lot of them on this class. So starting with the first, so under this class, we have the one that blocks beta 1. So in other words, they are selective for beta 1. and the beta 1 is located on the heart. So that's what allows the heart to contract. It's also located in the kidney, helps to release one important chemical in our body, which is called renin. We also have the one that work both on, not only on beta, it also work on the alpha receptor, which is located on the blood vessel. And then we have the one that block both beta 1 and beta 2. So beta 2 is usually located on the blood vessel. It's also located in our respiratory system. So let's start with the one that block beta 1, which are the atenolol, metropolar, and then bisoprolol. So this one, they are selective for beta 1. So they block beta 1 adrenergic receptor in the heart. So by blocking that, that kind of like slow down the heart rate and also and the cardiac output, and also decrease renin release. And by decreasing renin release, you also have added advantage there, which thereby decreasing angiotensin production. And earlier we spoke about the importance of angiotensin in the body. Common side effects, so fatigue, dizziness, because they slow down the heart rate, so it could lead to bradycardia, so it can slow down the heart rate. It could cause sleep disturbances, and then most importantly, especially for people who have diabetes mellitus, this could mark the symptoms of hypoglycemia. So hypoglycemia is when the blood glucose is low. Because if, for instance, if you have diabetes and your medication that could drop your blood sugar, like sulfonylurea, like insulin, the way you go to know that your blood sugar is low is the adrenergic response, what we call adrenergic response, whereby you start to sweat, you start having palpitation, whereby your heart starts to race. But if you're on this medication, that could blunt that, so you may not have that palpitation or increased heart rate to alert you that your blood sugar is low. So just something to be aware of. In terms of price, depending on which pharmacy, so you're looking between 1,000 to 2,000 for particularly for atenolol. For carvedilol, labetalol, those ones are non-selective. So in other words, they work on both beta and alpha receptor. So they block beta 1, beta 2, and alpha receptor. So by blocking beta 1, that could decrease, so similar to what atenolol, metropolar are doing. So that will help to lowers the heart rate and the cardiac output, and also decrease renin release. But by blocking beta 2 is important for the relaxation of the muscle of the smooth muscle in our breathing pipe, in other words, in the respiratory tree. So in somebody who have asthma, by blocking that beta 2, that could be a disadvantage because that could worsen the asthma, especially people who have what we call reactive airway disease. It also block alpha 1 receptor on the blood vessel. So by blocking that, that allows the blood vessel to relax. So thereby decreasing the heart rate and it dilates the blood vessel. In terms of side effects, so because they're blocking the beta 1, so it could slow down the heart rate, so it could cause bradycardia, it could cause hypotension, dizziness, fatigue. And then because they block the beta 2, that could worsen asthma, especially in somebody who have uncontrolled asthma. The labetalol, one good thing about labetalol is one of those medications that is safe in pregnancy, because it's not all this medication that we can use for hypertension in pregnancy. So there are some of them that have been well studied and they are safe in pregnancy. So things like labetalol, nifedipine, hydralazine, and metidopa. So those medications have been considered to be safe in pregnancy. So labetalol is one of them. And then we also have the non-selective beta blocker like propranolol, which they call it non-selective because it blocks both beta 1 and beta 2 receptor, so which could decrease heart rates, can relieve anxiety and migraine. So in terms of side effects, before we even talk about side effects, one good thing about propranolol is one of those medications that we use if somebody have hyperfunctioning thyroid. So if somebody's thyroid is really hyperfunctioning, this is going to be our friend here to help to decrease, in addition to decreasing the heart rate in those patients, you also have to decrease peripheral conversion of those hormones. So in terms of common side effects, so fatigue, cold extremity, they could have stomach upset, and because it blocks the beta 2, it could worsen asthma in people who have uncontrolled asthma. Moving on to the next class of medication, which is the alpha blockers. Here we have the prazosin and doxazosin. So looking at doxazosin, so how do they work? So they block alpha 1 adrenergic, they are alpha 1 adrenergic blocker. So alpha 1 is located on the blood vessel. So by blocking that alpha 1, that prevents the blood vessel from being tense. So that allows the blood vessel to relax, thereby decreasing the resistance in the blood vessel. So common side effects from this medication, so dizziness, because by blocking those alpha, you relax in the blood vessel. So if somebody stand up quickly, that could cause dizziness. Sleepiness, swelling, nausea, hypotension, and then because of increased blood flow to the sexual factory, that could sometimes cause priapism. In people undergoing cataract surgery, they could also have floppy iris syndrome during surgery. So it's important if you're on this medication and you're going for cataract surgery to discuss with your eyes doctor. Another good thing about this medication is that they are not only working on the blood vessel, they also work on the prostate. So if somebody have a big prostate and they have a problem with passing their urine, this might be a good, especially if they have high blood pressure, this might be a good medication for them because it's not only working on the blood vessel, it's also working on the prostate, thereby facilitating urination for those patients. In terms of price, depending on which pharmacy you go to, you're looking between 2,800 and then to 12,000. You're looking at 2,800 naira to 12,000 naira, and of course, depending on the strength of the medication. Moving on to the central alpha agonist. So here we're not talking about alpha 1 here, we're talking about the alpha 2. So the alpha 2 are centrally located receptor in our body, and the goal of those alpha 2 is that they decrease the outflow of sympathetic, so which is kind of like the flight or flight. That's what increases our heart rate. That's what tends the blood vessel that could make the blood pressure to go up. So by targeting those alpha 2 receptor, that helps to decrease the sympathetic outflow, thereby prevent the blood vessel from being tense. So another one causes vasodilation and also help to lower the heart workload. So the medication under this class include metidopa, which is also called Adomet. Clonidine is also part of it. So in terms of this common side effects, they could cause drowsiness, dizziness, headache, malaise, dry mouth, and potential depression and fatigue. One thing to mention here, like I mentioned earlier, metidopa is a good medication is considered safe in pregnancy. And clonidine, we usually use clonidine for very resistant blood pressure, like blood pressure that is very difficult to control. But one thing to remember about clonidine is that if you've been on clonidine, you can't just stop the clonidine abruptly, because if you stop it abruptly, it could lead to rebound hypertension, and that could create more problems for you. So it's important to talk to your doctor before stopping your clonidine. In terms of price for metidopa, so also depending on which pharmacy, so you're looking at between 1,200 naira to 4,000 naira. Moving on to the next class of medication, which are the direct acting vasodilators. So under here we have hydralazine, minoxidil, and we also have nitrates. So I'm going to start with the hydralazine. So they interfere with intracellular calcium release through a particular pathway that we call the IP3 inhibition. And by doing that, that causes relaxation of the smooth muscle in those blood vessels and allowing them to relax. In terms of common side effects, so they could cause compensatory increase in the heart rate, which is what we call tachycardia, headache, fluid retention. And the people who are slow acetylator, which is one of the way how we metabolize this medication in our body, that could increase the risk for what we call lupus-like syndrome in those patients. And of course, if those patients develop this, then you might need to see your provider to do additional workup for you. And they might be checking things like some antibody like ANA or anti-histone in that case. In terms of price, depending on which pharmacy, so you're looking between 10,000 to 13,500. And I want to mention here that the hydralazine could come in form of tablets, and it could also come in form of injection. So tablets is what we usually take at home, but of course injection is going to be limited to use strictly in the hospital because this could drop the blood pressure rapidly. So the patient has to be in a monitored setting. The next one is minoxidil. The way this one works, it actually opens what we call the ATP sensitive potassium channels. By opening it up, this leads to what we call hyperpolarization, and thereby this is how it's able to cause relaxation of those blood vessels, and thereby lowering the blood pressure. Common side effects, so this can actually cause what we call hypertrichosis, which is excessive hair growth. It could cause fluid retention, it could cause the increased heart rate, and there has been some cases of pulmonary hypertension with this medication. In terms of price, this medication actually is not commonly used for hypertension in Nigeria, but they use it widely for hair growth. So people have alopecia, so they use this medication for them in terms for topical solution. And in terms of price for that, you're looking around 6,000 to 10,000 for this. The last one here is nitrates. Under here we have the nitroglycerin. Nitrate relax both the veins and the artery, right? So it relaxes both of them, right? So the veins is the vessel that carries blood to the heart, and the artery carries blood away from the heart, except some certain exception, particularly in the lungs. So particularly, this works on the veins. It also works on the coronary arteries, which is what carry blood flow to the artery and to our heart, thereby reducing what we call preload. Another preload is the blood that is the load of blood that is coming to the heart. Also improve myocardial oxygen supply. In terms of side effects, so this could cause headache. So headache is actually a big side effect of this medication. Flushing, it could cause what we call orthostatic hypotension. So that's where if you, after you take this medication, if you stand up suddenly, that could make your blood volume, your blood to cool down, and that could cause dizziness. It could make your heart to start racing and a headache. It could cause reflex tachycardia, meaning that it could make the heart rate to go up. And really, especially if you're using the IV medication or using a lot of dose of this medication, or you're taking it with other medication that could cause methemoglobinemia, really it could cause what we call methemoglobinemia, whereby it changes your hemoglobin to what we call methemoglobin. And the thing about methemoglobin is they don't carry oxygen, as opposed to hemoglobin that really carry oxygen. So this could be a life-threatening condition. In terms of price, so for nitroglycerin, so depending on which pharmacy you go to, the price also vary for the nitroglycerin. So in summary, number one, please consult your primary care physician to determine the most appropriate antihypertensive treatment regime for your specific health needs if you are living with hypertension. And the prices listed in this presentation are approximate and based on Nigeria online pharmacy sources. And generic medications are generally more affordable when you compare them to the branded imports. And then lastly, prices vary by region, pharmacy chain, and the current availability. To the end of today's presentation, don't forget to like, subscribe, and share this video with your loved one. And don't forget to follow us on YouTube, TikTok, Facebook, and Instagram. And I will see you in the next video.